We're talking about how COVID has changed healthcare and how we cover it. We have Stephanie Ilgenfritz here to moderate that, along with Cynthia Coons and Apurva Mandavili. Looking forward to this. Please take it away.
Hi, everybody. Thanks for having us here today. I'm Stephanie Ilgenfritz. I'm the Health and Science Coverage Chief at the Wall Street Journal. I run the team that covers the business of health and science and health and medicine. With me today is Cynthia Coons, who is the team leader for U.S. Health at Bloomberg. And prior to this, and during the height of the pandemic, she wrote features for Business Week as a senior reporter covering all things health. And Apurva Mandavili is a science and global health reporter at the New York Times and has covered COVID-19 since the start of the pandemic. She is a 2019 winner of the Victor Cohn Prize for Excellence in Medical Reporting. So thanks for joining us all. I thought we would each of us in turn share some thoughts about the theme of the talk, what we think has changed and what might be permanent, what might be transitory, and then we would chat a little bit amongst ourselves about the things that we have all experienced, and then we would open the floor up for questions. And I think that there are mics in the aisles. Basically, I thought I would start by one of the things that I think I have seen the pandemic cause a real change in is everybody else's understanding of health. It forced every sector of society to understand the importance of health and realize that health is important to business and economy and society, and not just individual health and public health, but it has fingers that really reach into everything. And that has meant in a big newsroom, and I think we're all working big newsrooms that cover kind of everything, means that everybody becomes a health reporter. They have all had to get up to speed in a variety of things and see the health angle in their beats, and it's been one of my jobs to help support that, and I'm going to guess that you have each experienced that as well. Education reporters who used to cover, or still do cover, teachers' unions and early childhood learning have had to learn about the difference between aerosols and fomites and the importance of ventilation. Foreign correspondents all over the globe have had to get very fast lessons in microbiology and statistical analyses. Reporters in Israel who have been covering the conflict with the Palestinians are learning about the electronic medical records of their country's national health system, where they got the first signals in some cases of the vaccine's efficacy. And in South Africa, the reporters have learned a big lesson in immunology and microbiology, where some of the variants have arisen. And then, of course, all the reporters in China, ours got kicked out. It's a different story. Have had to learn a lot about how the health systems work. And of course, national reporters who cover the economy and business have had to grapple with concerns about how to trust the science and obviously the huge impact of lockdowns that have rippled throughout society and our economy and the markets. So a big part of my job has been coordinating all of that, helping to drive coverage and be a backup for all of my colleagues, identifying big themes for coverage. It's meant a lot of meetings, and I think if there's one thing that the pandemic has done, it's meant a lot more meetings. I think that that's probably something that you've all experienced. That, I hope, is a change to journalism that doesn't last, but we'll see. And following from this idea that we're having to coordinate coverage globally across themes with people who are smart journalists but don't have specific experience, that leads me into the challenge that we have all experienced, I think, with covering the uncertainty of the pandemic. We've got, it's kind of embodied in the experience of a lot of my colleagues who are super smart but don't necessarily have experience covering science or big data. And we've all had to try to be judicious in how we respond to new information, while being fast and trying to also, find meaningful ways to interpret it for the reader. I used to tell my reporters early on, we can't be writing every story that says, scientists don't know, we need more information. That's not super helpful. So we're trying to find meaningful things to say out of fast-moving and very uncertain information is a challenge, and it's especially hard for people who don't cover science all the time. When you look at data, it seems like that should have some answers for you. And the challenge is to convey to people why that first number that you see might not mean what you think it means. Something like the case fatality rate isn't a number you can really rely on and say that this number of the number of deaths per number of cases actually tells you how deadly the virus is. You can't use that data because we actually don't know how many cases there are. The denominator is not useful there. And it takes a long time to kind of explain to people how to be nuanced in how you convey the data that's coming out, why it's so limited, and why the scientist that you just spoke to that did the experiment in the lab and is very excited about it isn't necessarily the whole answer, or the paper that was printed on a preprint website that seems to tell you that, well, the vaccines don't work, doesn't necessarily mean that that's the case and you should write that story. This is all very nuanced. And so that is one of the challenges I think that everybody has experienced in the pandemic is nuance, covering uncertainty and conveying that in fact it's uncertain, and that's the reality that we live in, and the challenges of covering big data when the data is dirty, as the data reporters say. And I think those are the main themes that I wanted to start with, but I wanted to let Catherine and Apurva offer their views as well. So maybe Apurva, we'd start with you and you could share your thoughts.
Sure. I mean, a lot of what you said really resonated with me, but the thing I think that I experienced most strikingly during this pandemic is what you said about uncertainty. And the way that played out for me is that I write about the CDC and the FDA and just public health decisions a lot. And in previous infectious disease outbreaks that I've covered, I've been able to basically believe what these agencies have said. And what I discovered over and over during this pandemic, really disappointingly, is that when there is uncertainty and when there was not a clear path to what to do, that these agencies repeatedly projected a level of confidence and certainty that they did not have, and also that they were really, I mean, this is kind of a strong word, but they were infantilizing the public by thinking that we can't handle complicated information. And so the version of things that we heard often was a very oversimplified, not quite based in science, but being presented as science information. And so it really fell on journalists to ask tough questions. And I'll be honest with you, it took me a while to figure out that this was happening, because initially I was still in the old mode of essentially believing everything they said, even though, of course, as a journalist, you're always skeptical, but you don't think that they're actively lying to you. But it took a while to really start to understand that the CDC was actually out of its depth, that it was making mistakes, that it was saying things that were not true. I mean, you all remember the masks, starting with just that, being told that we didn't need masks. And I speak to a lot of researchers outside the country, and I was hearing from them that, we know this is asymptomatic. We know that masks are needed. We know that people transmit before they have symptoms, and yet we were hearing something very different. And so, that's when we started to ask questions. And again, when, the vaccines were rolled out, for example, I remember talking to one of my colleagues and saying, it seems like these vaccines can't all be the same because they have different platforms. They use different mechanisms. They're different companies. They've had different clinical trials. They cannot possibly be the same. And yet what we were being told very strongly was these vaccines are all the same. Just get anyone who can. And the second part is correct. I think we all did need to get whatever vaccine we can, but the information that was being projected was something else. And what my colleague and I were talking about is how much pressure we felt, both from public health agencies and from experts, to carry out essentially their mission, to say to the public, go get any vaccine you can, and they're all the same. And that we really shouldn't be saying anything negative or critical about the vaccines, be asking tough questions. And that, I don't think, serves anybody well. And so it took us a while to really start asking those questions. And in the last year or so, when I have started to do that much more, I've been shocked and really quite disappointed in how much information has been kept from the public, how many decisions have been made on very poor evidence but projected as something else, and also just how much they've betrayed people's trust in a way. And for me, that means that I will never again cover this beat the same way. I don't know that I will ever look at the CDC and just take what they've said at face value. Not that I should have even before, but to have the CDC, the WHO, the FDA all be institutions that you can't trust was really quite shocking. I remember talking to somebody at the Korea CDC early on, I think it was May or June 2020, and she was so confused. She was like, everything we know we learned from the US CDC. What's going on over there? We didn't have any good answers for that, obviously. And then the other thing that I liked what you said is, how everybody had to learn how to cover this. And one big thing that I experienced was the pace. Because before the pandemic, I had this rule that I would never cover a preprint, which is, has not gone through a very rigorous scientific review before being published in a journal, and we just could not follow that rule anymore. So I had to cover preprints, and that meant I had to kind of conduct my own private peer review. I would send the preprint out to some experts that I trusted, ask them if it was worth covering, and then if they said yes, send it to many more. But all of this had to happen really quickly, and throughout there was this real sense of urgency, like this is a matter of life and death. And I have not experienced quite that level of pressure that relentlessly, I don't think ever. So that was really challenging.
I should probably note that we're using some language here that you may or may not know. I used it preprint, but although the public has gotten a pretty fast education in microbiology and in peer-reviewed medical literature as well, but that means it hasn't been gone through peer review at a journal, the medical journal. It is just being posted without having gone through peer review, which means that experts will vet not the actual experiment, but the basics of the experiment and the math that they did to come up with their conclusions. Anyway, Kath.
Yeah. I think
Cynthia.
one thing that really stuck out to me in building on some of the things that you raised as well was it was really a pandemic of haves and have-nots, and we really saw that in the disparities by race of outcomes and how access to the healthcare system is just so divergent in this country based on where you live and to some extent what color of your skin. And I think part of what that I feel like we know that, and there have been a lot of studies into some of those issues in the past, but I think what happened in the pandemic was such an amplification of that problem here. So when I think about, okay, how has healthcare changed, my bigger concern is that it has not, and that we haven't really seen really systemic shifts within the industry itself to be able to reach people where they are and make sure that healthcare literacy, access, and education is where it needs to be. So I think when we think about it going forward, too, being able to stay on that story and look at the injustices of the last few years and recognize that those are fundamental injustices that have always existed, and we know better, and we need to keep that front of mind as we continue to cover health and public health is one of the really big takeaways for me. Also, public health as an entity doesn't get a lot of funding, and from a perspective of where I work, we cover the business of healthcare. So public health comes in and out in terms of what we cover, and now you can't ignore it, but it's also still not getting funded. So that's pretty interesting that we're in the process of learning about this disease and we're still dealing with it. You probably all know people who have it right now. And Congress is struggling to figure out how to get the money together to continue to fund this at the government. And so that's really something that I also think about when I think about this going forward in terms of maybe not enough has changed. And so when we view the stories we want to do and the things that we thought were unjust about how COVID played out, we need to keep that sort of level of attention to these agencies and issues going forward, because they're just simmering, and things aren't necessarily changing as fast as they should be.
I think that's exactly right. I think that was one of the things that I was struck with early on, that the pandemic really underscored the existing disparities in our healthcare system really dramatically, because you saw it in the death numbers. Mm-hmm. Those were numbers that you could rely on. I mentioned that some of the numbers were not very reliable. The death certificates are. At least once they figured out what COVID was. What you were saying about what healthcare itself changing, I wanted to actually kind of tee off something that you mentioned about, can you trust what comes out of the CDC? Another theme I think that has come out of all of this that is affecting the whole country is, I don't know, and I love your thoughts on this. It seems that there's a lot of erosion of trust in public institutions in general. And what effect do you think that has on healthcare?
Well, there's an erosion of trust in us.
Yes,
and that's
that
really
too.
The amount of jokes that have come at me about fake news kind of things that it's always been percolating, but it's really interesting. Even seeing it somewhat play out in terms of the responses to some of our own coverage. And I think the erosion in trust it's really disconcerting, and it's getting worse. And so that I think that idea of like, how do we get around disinformation and misinformation? How do we handle and communicate things like the need for vaccines or the role of treatments? And how do we get around a public where a substantial amount of people don't necessarily think they even need a vaccine at all? And yet now the message is, seek treatment. These are the drugs you might be able to take if you're sick. And so where we're really missing out is a part of the population that don't believe even in what the media is saying. And I think that's a pretty humbling place to be, and I think that's worse than it's been, at least in my career. I'm not sure what the answer is. I think it's always important to make sure that we're telling these stories from everyone's point of view, and when we talk about the experience of COVID, we're not just writing about it from this sort of part of the country where there may be much higher vaccine uptake. It's worth really understanding life in communities where the belief in what's being told to them from public health officials, the belief system isn't there. But I think that's a really fundamental problem, both for public health and for us as media. I'm not exactly sure what the answer is yet, but I think but we have to be cognizant of it because it's not going away.
Yeah, I'm sure you have thoughts as well.
Yeah. I mean, from my perspective, I think we lost trust as soon as these institutions stopped being transparent. If without transparency, without a complete honesty, you just don't have trust. And, in retrospect, looking at all the decisions that were made, I think a lot of them were made with the best of intentions and, taking in not just science and public health, but everything. But people needed to hear all those things really openly, and I don't think that happened. So I would hope that when we get into a next pandemic, which I think will happen, that we learn that lesson, that we have to be open about this is the decision that we're making based on this. But it's also based on economy. It's also based on this other thing, and it's also based on this other thing. And I think we as journalists have to be very careful about also shining a light on that and saying, this is the actual truth. This is actually what's going on. Because I spend a lot of time on Twitter, and it's to me a window into people I wouldn't normally hear from or know what they think. And the thing I keep hearing over and over and over is, why should we trust anything the CDC said? Or why should we trust anything that the administration said? They've lied to us so many times. And when you lose trust, you lose the complete ability to influence the public's decisions. So honesty and transparency seems like a good first step to get started.
I feel like a lot of the things we've spoken about in these last few minutes come together. The speed, the need for public health officials and companies creating vaccines to act quickly, publish quickly, scientists putting out information as soon as they got it quickly, the need for journalists to try to assemble that information quickly, but also the lack of transparency and perhaps confusion over how much they should tell, engendering a distrust of institutions. I think it all comes together and manifests itself in vaccine hesitancy. One of the things that you heard a lot from people who are not hardcore, what you call anti-vaxxers, I'll be careful about using terms, I don't actually mean that to be derogatory at all. People have some heartfelt reasons why they're worried, but people who weren't previously necessarily against vaccines still didn't want to take the COVID vaccine because it was developed too fast. They felt like they didn't understand it, and they were worried. And I can tell that from our coverage, those were some of the hardest things to cover. When to cover people who, and these are humans, right, and who have struggled to make decisions in their lives in extraordinary circumstances, is hard. There was a temptation always to say that people who wouldn't get vaccinated were harming others. But it was not really that simple because people were confused and didn't feel like they had good information. And trying to cover the people who were vaccine hesitant in a way that didn't demonize them was a challenge. One of the hardest stories we did was a big page one story we did about the nurses who didn't want to get vaccinated because that brought together a lot of factors. The hospitals were struggling to maintain staffing. They were in surge. They needed their nurses, but they also needed their nurses to not get sick. So they wanted them to get vaccinated, but they couldn't force them to get vaccinated. And you would think that the people who worked in healthcare would be the most willing to embrace a medical procedure, so to speak. And yet there was a core of nurses who conversely felt, I have too close an association with the healthcare system, and I have my suspicions, and it's too fast, and I don't want to do it. And writing about people like that in a nuanced way that gets across the impact of their decisions, but shows some understanding for why, and the macro reasons why is one of the big challenges that I think journalists had, and I wonder what were some of the things that you found challenging to cover?
That's definitely was a big one as well. I mean, I think also just building on the idea of we were lied to, and this is something I feel like so the tricky part here was that even at points I felt that way too, in the sense that I was like, wait, this vaccine was supposed to be a lot better than it really is. Like, I just feel like even for us, we were learning and understanding it at the exact same time because the virus is changing, because nobody knew what they were dealing with. Like, we're talking to the people with the most information in the world, and even it's changing right in front of their eyes. And I don't actually know if I've walked away with a greater understanding of how to do that again, except to know that the bottom can fall out, and then you think you're done with that, and then the bottom falls out again, and then you think you're done with that. So it's just like you're grabbing and sort of waiting and hoping to see where is this stabilizing. And I think this current wave of COVID is kind of like that too. It's quite mysterious. Lots of people have it. We don't really know how many people have it. People are using at-home tests. Why do the vaccines work? So I think some of the problem here too is just baseline fundamental understanding that the scientific process is just catching up to a brand new thing that we don't know a lot about. I don't know how we necessarily in media communicate that, but I think it's one way to also think about things that I've definitely been thrown back at me as lies that I could confidently say that was not a lie. It's just the circumstances changed. But maybe we didn't do a good enough job communicating that in the way we wrote a story. Like, oh, perhaps we should have said the way the virus has mutated has potentially created a scenario where the vaccine, instead of, we didn't necessarily know that, but that might have helped like hold readers' hands through that process, because no one was holding our hands through the process. Everyone's just living it. And now maybe I think too that's part of how this trust erosion happened, partly because it was all changing in front of everybody's eyes.
Yeah, and I think there was an element of not being able to tell how much of what we're hearing is genuinely the virus is changing, and how much is because it's the decision that makes the most sense for the country for other reasons, and how much is because that, you know, like when you think back to, you know, don't stop wearing a mask if you're vaccinated. The respiratory virologists that I talked to were all like, what? That doesn't make any sense. But then, of course, we find out in retrospect that the decision was really made because they were offering a carrot to people to get vaccinated. Instead, if they had said, you know, you can take your mask off for a while, but we're probably going to ask you to put it back on. So there was a lot of that kind of, you couldn't tell what was going on. I think that is what breeds the mistrust. It's like not being able to say, okay, they really don't know what they're doing, and that's okay, because we don't either, and we're all in this together. It didn't feel like that. It felt like they knew things and they weren't telling us. And that's a very different feeling, I think, for people to feel like they're not being let in on the thought process.
I think another moment kind of like that, where policy started to change and it made people wonder, well, why did we ever have to do it then, was when it really became clear, it was to happen at different points in different parts of the country, that the economic and the education cost of some of the lockdown and mitigation policies in some people's view was greater than the cost of like risking letting people go without a mask and or go into stores and not social distance. And those were tough decisions to make. And to talk about conveying uncertainty, it was really hard to convey that, because I think you're right, it's not always clear why people were saying in some towns, okay, we're just going to go without a mask. And it became, well, masks are evil, as opposed to like, look, no, it's just worse to not have your kids in school.
Right.
Those were really hard, nuanced things to try to convey.
The other one I would just add to that is the 5 days, when the quarantine fell to 5 days. And it's funny because I was on a text chain this morning, and it was people trying to figure out when they were supposed to get out of quarantine. And everyone had a different idea and answer and timeline, and what did your doctor say, what did your doctor say? And I think no one really knew when the 5 days, we knew that flights were grounded, and we knew that there were a lot of reasons why people needed to get back to work, but again, the data wasn't presented as, let us show you the trajectory of how the virus is in your body and why at day 6 it would be okay to get back to life, after being told for a year or two that you had to stay home for 10 to 14 days. So that was a mess that I think is still messy. I think people are still really confused.
It's still very messy. And the thing, you know, when I've said the CDC, I really mean like the decision makers, because I talk to people within the CDC, secretly, of course, not like on the record, but what you hear over and over is they're really unhappy with that, also with that certainty being presented. And that decision in particular was really controversial within the CDC. They were so unhappy that the information was going out as 5 days and you're good, because that was all based on Delta and Omicron's really different. And because it was based on economy, because it was based on, we don't want airplanes to be grounded, we don't want, restaurants to shut down, which is a totally appropriate thing to decide in a pandemic.
It's a conversation that should have probably been a lot more public. Like, look, we're just going to make that trade-off. This is our acceptable level of risk, and here's why. And it has to do with the economy, and it has to do with getting kids back to school, and so we're going to make a decision that might be a little different if we were going purely on the science, but that conversation didn't really quite happen that way.
Right.
That makes it hard to cover. I have to say, I don't have a clock. There's no, if there was, so I have no idea how much
It's 1:52.
time we had. Do we? Okay, well, because I want to leave time for questions. So, if anybody has questions, you might think about it for a moment. You might want to start coming to the microphones if you have questions. But I wanted to actually talk also about misinformation and the challenge of dealing with that among readers who complain sometimes about the coverage. You failed to mention that really, it's ivermectin that will solve everything. Or even sometimes among colleagues who come to you in the newsroom like, I heard this, well, maybe that's a separate part of the conversation when you kind of have to be the doctor for the newsroom. But combating misinformation when the readers are coming at you, where they found things on the internet, we cannot explain individually to every single person this, admittedly, at times uncertain science. How did you deal with that?
Yeah, I landed squarely in this because one of my big pieces earlier, I guess it was last year now, was about Merck's drug, molnupiravir, which at the time looked like it was going to be the front-running COVID pill. Later, Pfizer's results were better, but at the time it was a big disruptor, and I think even like the markets rose when there was data from the pill because people were so excited this is the end. And it was so interesting to me because so many people came at the vaccine conversation with, you don't need a vaccine, you can take ivermectin. But then, Merck also makes ivermectin, by the way, which is just kind of funny, because then people were going after the pills, but they weren't. There was a lot of conversation around whether or not the pills were going to be the answer for people who didn't get vaccinated, and I just was stuck wondering if people, were there going to be any treatment options? If someone weren't unvaccinated, would they even believe in a drug created by Merck? Because a lot of this also was very specific targeted distrust of the pharma companies, which has existed long before COVID, and it will go on long after. It just is the way it is. I think that's the nature of the way people are slightly suspicious of the companies that actually have profits on the back of illness. I think that's just the nature of the beast. Again, I don't know what the answer is. I certainly found my Merck story did really well on Twitter, and I was like, that's unusual by how well it was doing. And then I realized that it was threaded into all these ivermectin threads. So I was like, I think the story just got a huge bump from the ivermectin world. They were all like, ooh, new drug, which is so confusing because if you didn't believe in a vaccine developed by a pharmaceutical company, how come a pill was fine? So it left me in a world of I have no idea how we go after this. I think we try our best and cover it our best, but I've been really surprised at what people are willing to go after, and I've certainly got tons of emails about the benefits of ivermectin. I think I got one 3 days ago.
Yeah, we get a lot. It's funny, the hydroxychloroquine not so much anymore, but the ivermectin lives on.
It really took hold.
Well, our current FDA head, Robert Califf, has said that he thinks one of the greatest threats to life expectancy and public health today is misinformation. And it's that's spread on social media. And how have you guys dealt with that?
Yeah, I mean, at the Times, we actually have a couple of reporters who scour the social media, landscape to figure out what's starting to take hold. And then they write these amazing articles where the headlines are super simple, like the Pfizer vaccine does not cause infertility. That's the headline. So if you read nothing else, you still get that. And
that's some good SEO.
It's really, right? It's also good SEO, exactly. It's both, yeah. And I think one of the reasons that works is because misinformation works because it's so simple. It gives you a very simple, easy answer, whereas the reality is much more complicated and confusing and nuanced, and it leaves people feeling stupid sometimes because they don't know everything that they're hearing about, and misinformation gives you a nice, easy answer. And so I feel like one of the ways we have to combat it is also being very simple, which is tough to do because we're dealing with very complicated topics sometimes. But I've certainly admired a lot of those articles that those guys have written. But also, before the pandemic, before I worked at the Times, I ran a news magazine on autism science and was very familiar with the anti-vax establishment. And what I learned through that is that the people who believe in misinformation come in all different flavors. So some people are, hardcore. They're actually the ones placing it. I guess we call it disinformation. But then there are people who, just haven't had access to the information, people who are afraid, people who are just slow adopters, and people who are, just really wanting information but don't know which way to trust. There's just the whole range, and I think it's really important to address each group separately. So when people would approach me or ask things, I would always start by explaining certain things, but then you can always tell when they come back to you whether they are genuinely confused or they're just baiting and sea lining, as they call it on social media. But it's just a very sophisticated operation, and I think we as journalists have to be really smart about it and be ahead of it. I remember reporting in Rhode Island in December, right when the vaccines were being rolled out, and I was talking to some immigrant communities, and they had been hearing a myth about the vaccines inject the devil into your veins for 6 months at that point. So when, we finally started getting to, the vaccines are actually great, it's way too late. The train has left the station. So.
Yeah, the mark of the devil thing, that started very early on.
Very early on.
And one of the things that we've struggled with at times, I'm sure every news organization does, is, when you hear misinformation and rumors out there, what is the risk of, when you cover it, you actually inadvertently give it a platform? And it actually spreads. You're getting clicks for the story because it says ivermectin, but a lot of the clicks are for people who love ivermectin. And there's a danger there that's a tricky place to navigate.
And just building on that, actually, so when that story went out and everything, it was trending with ivermectin, it was before, I think, we were all writing about ivermectin and that it was as widely used as it was, because this was early on in 2021, and then that coverage took off. So to your point, when you see anything now, you should grab onto it and be like, what's going on? Because ivermectin in the beginning was kind of like hydroxychloroquine. It kind of went away, and then it blew up that summer. So, and I also
Why would you take a horse dewormer?
Yeah.
Who would do that?
And the other thing I will say is what is going on in your text chains, those are stories. That has been one of my huge takeaways because like you said about misinformation, a lot of really smart people are getting threads of things that they're hearing places and they're a little nervous, and then you just pull it out and you say, wait, let's just look into this. And that's where you can also get the Pfizer's vaccine does not cause infertility, because I think I first heard that, I think I was out maybe at a hair appointment or something, and I heard that, and I was like, oh, that's what people are saying now? So you do want to keep your ears out, even in your own orbit, because that is where a lot of these things are starting to...
Yeah, and Twitter's great for that. I hate Twitter for a lot of reasons, but and I particularly hate it when people are awful to me. But when I see the comments on why they're being awful, it's actually a great motherload of stories. They're confused about so many things. They're questioning so many things. It's actually really useful.
The antithesis of what is a motto that many journalists will repeat, which is never read the comments. But get it embroidered on a pillow. But sometimes you should. Do we have any questions? I just want to make sure we don't miss anybody who had some questions.
Yes. Andrew Leckie, because of the international nature of this, it has often been very disquieting as well. If you deal regularly with other countries and you're talking to people regularly and may even have some visits that are approved that you go to certain places, that it was run like a horse race in the news many times. Look what this country's doing. They've got it right. And there would be an explanation of something they do. And even in talking to people, they would say, well, they would be stating as fact something that their government no doubt had told them as fact. And you're listening to it, and it was such a potpourri of thoughts about everything. And even when we were told, don't wear masks, and then my friends calling me, are you...
It works.
maybe I shouldn't have brought that topic up. What do you think?
What is your question, sir?
It was the international nature of it. It seems it's made it even worse because you're hearing from all over the world, and in some cases, it's been handicapped. Here's a country that really has it right, and they don't have this many people and who have it, and it seems it has made it even more convoluted in trying to understand what's going on with COVID.
Yeah.
The question in there is how did we cover that and
Yeah,
address that?
How do you deal with, how do you compare, there's a lot of information about how various countries are effectively or ineffectively.
I think
I could talk a little bit about, to some extent, when I was doing a big project on Pfizer's rollout of its vaccine, Israel got the vaccine first, and I think we took a lot of our understanding of how the vaccine worked by how things were going in Israel. And it was very interesting because you cannot compare the US to Israel in so many measures, but also you can't compare the US to any sort of universal health system that can provide care to its entire population. So I take your point because I felt like we were hearing also sort of being told that if you looked at what happened in Israel, or you could see something from there that really didn't end up being applicable here, it was quite. But it might not have been obvious at the time because we were just making sense of it ourselves. And I've been thinking about this a lot too, because right now, if you were in China, your life would be so different than your life is here. And I think there has been a lot of, there's been a lot of nationalism around vaccination and pills and drugs getting around the world. And I think we have to be really conscious of that when we write about it. And we're not just writing about access here in the US because it's just such a different story if you're in a different country. And also, it's a very different pandemic depending on where you live. And one of my colleagues wrote a piece, I believe they were in Shanghai, and they were talking about how they couldn't even leave their block of apartments. This was last week. They could only go out for 4 hours, and when they went out, there was no one out, so they just came back home because they couldn't even spend 4 hours outside, like, enjoying themselves in any material way, which just brings me back to March of 2020. And so I think we really do also have to be conscious of that. And also that nobody got this right. No country can declare they did this right. Everyone took a toll, and I think some of that, at different times, people have tried to sort of play that they sort of did it right for one reason or another, but there are a lot of reasons why some of the lockdown ramifications maybe manifest in mental health issues and other problems. So I think there's still a lot to be learned by what's still going on around the world. And I think just in general, we need to be very conscious of how we report on that so we're not so, used to thinking about it the way we're living it right now and experiencing it.
I think you just always have to try to provide as much context as possible. I mean, another good example, Israel's a good one, is when Omicron first surfaced in South Africa, and it looked as though it was not as virulent. There were, a lot of cases, but there were not as many hospitalizations and severe cases. So it was tempting to say, well, sure, it's Omicron, but it's not as bad. But the thing is that Africa's population is significantly younger than the U.S. population, and it is much, by and large, it is the oldest people who have the highest risk of death and severe illness with the disease. So while it did turn out in the end that Omicron looked like it was less severe than Delta had been, we had to be very, very cautious. We could not leap to any conclusions in those early days. We had to wait to see, literally had to wait to see how it played out in the U.S. Are there other questions? Sorry, I don't know who's got mics. I didn't know if we had a mic runner.
I have one.
It's a little hard to see out there.
Hi.
Could you tell us who you are?
Who's good? Okay, thank you. My name is Alex Ruccolo. I'm from Cheddar News. You all mentioned your increasing skepticism towards the CDC and the WHO. I'm curious if you had any similar experiences with other research institutions or academia in general, and if so, how this impacted your real-time reporting on studies as they came out about COVID.
You want to take that one?
Sure. Yeah, definitely. I mean, it wasn't just those two. Those are probably the most impactful, but experienced it at all different levels from academic researchers as well. I'll give you an example. I wrote about how Moderna was proving to be better than Pfizer. This was kind of early on when those studies were starting to come out. And we were very clear, even in the headline, that they're both good vaccines. I think it said something like they're both blockbusters, but one is slightly better than the other, or whatever it said. And yet, I got really angry emails from very well-respected scientists at unnamed institutions but very good ones, saying, how dare you say this? This is a shameful article. You are going to undermine the vaccines. We should be telling everybody that the vaccines are great and nothing else. So there was just, I think, overall, this panic about getting a certain message to the public, again, probably with well-intentioned thoughts, but there was definitely a lot of confusion among the whole public health community, academics, all nonprofits, every level, about how to do it, how to communicate things, and whose job it is to do it. I mean, it's not my job to convince people to go get vaccinated, but they thought it was. So there's just a lot of confusion, I think, in general about what to do in a crisis like this.
Are there
Oh,
other-
yeah. My name's Noah Higginson. I'm with CNBC. I actually wrote about COVID in pharma. And I wanted to ask you about non-peer-reviewed studies and preprints, because I think, as reporters, we want to be first and we want to be fast. But with research, that doesn't really go hand in hand all the time. And so I'm curious to know if your view through COVID on writing about preprints or like non-peer-reviewed studies has evolved on maybe how you do that, and maybe if you could walk through how you go about writing those stories, because it can be, I think, kind of touchy, especially within like the research community and with scientists. They don't necessarily agree with reporting on that all the time if it's too early. So I'm curious to know how you go about that.
Go ahead.
Look, I would say it's partly why we need to do it right now is because we're in a situation where everyone's learning on the fly. It's happening so fast. So I think if it were something where it were research in a more developed disease area where we had more knowledge, I wouldn't rely on a preprint necessarily, because I would never have, right? I would do it in a situation where it's going so fast. And I was doing this with pollution in COVID and looking at COVID outcomes, and based on race, I was just sort of interplaying two issues to figure out if there was something there, and I had to work with a preprint because there was no way I could wait the amount of time it would take to get published. But in many other areas, you can, and there's a lot of already published research. And then there's also people who've been published and they've had enough like papers of enough level of credibility that you kind of know, okay, when they're publishing, if they're giving you a preprint, it's like it's going to be sort of respected, even if it's still in the earliest stages and might be up for some revision and questioning. I think the size of the study is really important. I think we can get really excited about a really blockbuster finding, so you have to be really particular to hone in on how many people it's being studied in. But I do think you still have to be really careful. There's a lot of exciting looking research coming out all the time that is really not what you think it is. So I think it's looking at the credibility of the author, the size of the study. There are probably other points that you can add to that. But I think ultimately you don't want to necessarily be relying on preprints unless it's like a crisis emergency like we've been in.
I would agree with that. And another aspect of the study you want to look at is, really what is the nature of the research? I don't know how many times I've seen things covered where the headline is that, this variant escapes immunity, and the implication being that the vaccines won't work. But really, it's just the cells, how they act in a petri dish. It's not about how it acts in the human body, because we don't know that yet. So there's a real danger of jumping on lab research and writing about it in a way that suggests that that is equivalent to human research. And I'm sure you have thoughts as well.
I mean, a lot of it is just approaching it like other news too, right? In terms of the urgency of it. How important is it? Do I really need to cover this? Because, because it's not 100% certain, can we just like wait until it is? And sometimes the answer is no, right? We do need to actually have this information out there right now. For example, when the New York variant came out, we wrote about it before the New York City government was ready to tell people, but people did actually need to know because it was already a significant percent of cases here. So that's part of it. And then, your information is only as good as your sources. So for me, they are absolutely key. I mean, I have been, covering papers for 20 some years, and I have like my tips and tricks, kind of like some of the ones that Cynthia mentioned. But, ultimately, if I'm not 100% sure about something, the sources are where they come in, and those experts can tell me, does this look okay? Does the method look okay? Because some of the methods, may not be familiar to me at all. So, I would say that's like absolute key.
There's a school of thought that this has been a good for science, for the speed of science and for communication of science, that the old paradigm of peer review in medical journals slows things down, blocks out promising research that doesn't fit stodgy notions of the way science should be conducted, and that this is a better way to conduct science, and just let it all come out in the wash and be vetted by the court of public opinion.
That's actually true. It actually worked out that way, right?
And I think there's some truth to that. But I think in the end, I don't think that that's going to be the way everything will then turn to permanently. I think we'll find some kind of hybrid, which is actually not too dissimilar than the way it's been. Most of the time you wait for peer review, but I think we've all also taken papers directly from scientists that as you guys both described, that you trust. And now those are essentially preprints. You sometimes do write about research that's going on before it goes to a journal. And I think we'll probably, in the end, kind of the pendulum will swing back a little more to a hybrid like that.
Yeah, I mean, it's been good for biologists in particular, I think, because physicists have been doing this for decades, but biologists and medical scientists have always been very, very nervous about it, partly because of the medical implications, but also just the really ugly competition that can exist in biology labs. But I think it has been really good for them to chill out. I also saw a study recently, actually, that looked at a whole bunch of preprints and the final version that appeared in a published journal, and they weren't all that different. Something like 85% were the same, and then when you actually looked closer at what the remaining were, it was mostly grammar and style changes, not substantial changes to the findings.
That looked at the ones that did get published, right? Not ones that didn't. So. And I suppose it would be slower to come to biology because if you make a mathematical calculation correctly in the orbit of a moon, nobody's going to die. So, do we have time for another question?
Sorry. I have a quick question. I was a business reporter during the pandemic in a state where a lot of people didn't believe in vaccination. And one of the things we had a lot of trouble with was getting the state health department to give us company level data about massive COVID-19 outbreaks. They used the excuse that, well, the companies aren't going to participate, saying that they have a massive outbreak at a petrochemical plant or whatever, because, well, they won't tell us anymore and we need the data for public health reasons. So if you have any advice on either how to get that data, how to persuade people why that data is important to help protect the public in real time, or any advice how to navigate an issue about that.
Did you make a state open records request?
Yes,
or were you
and
just...
I was HIPAA'd. I was told that it was protected by HIPAA.
Yeah, people use HIPAA a lot. The things that most misused law on the books. I don't see why HIPAA would apply there. So HIPAA only applies to healthcare providers and health insurers. But anyway, you want to address
I don't
how to
actually, I
coerce
couldn't
data
follow
out
some
of
of the
states?
question.
Let me see if I can rephrase it. You believe that the state has data on the employers in their state and the cases that were reported in workplaces?
Yes, so they published a dashboard that had the number of cases at different types of industries per employer, but they had it in aggregate. And so for them to create that aggregate, they were not estimates. They were told by the companies to the state, we have a COVID outbreak, here's how many people are sick. We tried to get the names of the companies that had outbreaks so workers at the companies would know there was an outbreak, because the companies were not always telling them.
Did you try OSHA? Occupational Safety and Health Administration. That would be a FOIA, federal request.
Yeah, no, I've tried OSHA, because they have the whole closed records request and they have the open investigations, and that whole process was backed up.
I mean, when all else fails, I like to go through people. I mean, do you know people who know people within the Department of Health? Because
or even in the companies
I would
themselves.
actually suggest you might also talk to employer groups in your state. There are organizations of employers that actually specifically are organized, like the Pacific Business Group on Health. There are employer organizations that you may be able to talk to that somebody there might be friendly.
And unions are
Unions?
really
Oh,
good at
that's a
this.
good one.
I think when you have a hunch, so say you're exploring this specifically because you have a hunch about something going on at one place or a tip, just going specifically after that and finding out from people there, trying to find workers, LinkedIn, you can find people who work inside places, is probably you're probably going to do better doing it, chasing it all up yourself than trying to get the institutions that would be given the data about something happening. I think there's always going to be a delay and a hesitancy on that, whereas people inside can tell you what's going on in some ways a little bit more intimately. That's one idea, because I haven't found that we've been able to really go through that data and get more clarity on the specifics of things going on, even in different types of examples. I think going straight to the source and the people who are impacted through workers' unions or through
Who would have an
LinkedIn.
interest in having that information out? Who would want it out?
The most local media sources too often have stories about things going on that might not have gotten bigger press at that point.
Great stuff. Thank you so much. Thank you, Stephanie. Thank you, Cynthia. And thank you, Apurva.